Hi, I'm Dr. Brian Quebman. I'm a bariatric surgeon and I've been doing bariatric surgery for over 25 years. I'm also formally trained in foregut surgery, which is esophageal surgery and surgery on diseases of the upper gastrointestinal tract, including the esophagus and the stomach. I want to talk briefly about something that's been bothering me recently, and it's hiatal hernia repair during bariatric surgery, or repair of a hiatal hernia, treatment of reflux during weight loss surgery. I use various assistants when I do the surgery, and the way I repair the hiatal hernia, I'm told frequently, gee, I've never seen anybody do it this way. And I say, well, how do they do it? And they say, well, they put a stitch right here in front of the esophagus. And I said, well, that's not a repair of a hiatal hernia. And so I want to explain to you what I mean when I say that to the person who's assisting me and the people in the operating room. So what I'm here today to talk about is hiatal hernia repair during weight loss surgery. Now, in order for you to understand what I'm talking about, you have to know the anatomy somewhat. So I've drawn diagrams of the anatomy. What happens is the esophagus goes down through your chest and then passes through a large flat muscle called the diaphragm, where there's an opening called an esophageal hiatus, Hiatus, which indicates an opening. The esophagus passes through that, and beneath this diaphragm, it turns into the stomach. Okay? A hiatal hernia is where the opening in the diaphragm gets larger, and the stomach pushes up into the chest. So to illustrate that, I've done my own drawings, and this is the normal anatomy. This here is the diaphragm. A diaphragm muscle has fibers sort of like this, and what we're doing is when we're looking this way, we're looking from the inside of a person, from their abdomen up through their chest, into their chest from below. So this is the diaphragm from below, and the esophagus comes through the diaphragm for a distance of approximately 2 to 3 centimeters or so, and then turns into the stomach. So we're in the abdomen from this perspective, and we're looking up. So the diaphragm muscle encircles the esophagus and crosses behind the esophagus. In fact, this cross is called the diaphragmatic crura, C-R-U-R-A. This side is the right side of the patient when we're looking up, and it's called the right crus, C-R-U-S, of the diaphragm. This is the left crus of the diaphragm, and they cross. And when they cross, they close off the opening so it's the appropriate size, and that helps prevent the stomach from pushing up above the diaphragm. When somebody has a hiatal hernia, they have an enlarged opening. And the way that the opening is enlarged is the cross where the esophageal fibers come through and the diaphragm crosses. That cross of the diaphragmatic crura gets wider. It's sort of like this. The diaphragm comes over and the muscle crosses. The esophagus comes through. And when this opens up behind the esophagus, the opening gets bigger, and that's how it occurs. So this is the diaphragmatic crura opening up, getting wider behind the esophagus, and this opening is bigger. Yes, you can see the opening is bigger in front, but it's because it's gotten larger or wider as this has, the cross has uncrossed, basically. Okay? And then what happens after that is, with this larger opening, the stomach from below pushes up through the diaphragm, and you get herniation, meaning push up through the diaphragm, pushing like a groin hernia or belly button hernia. Part of your intestines or insides push out through the opening. This is pushing up through the diaphragm, and the stomach is pushing up there. And when that happens, the junction between the esophagus and the stomach is distorted. It doesn't work. And it's much easier for acid to wash up into the esophagus, and you get heartburn, and reflux because acid and other stomach fluids are washing up above the diaphragm. The stomach is where it should not be, and this because this opening has enlarged. That is a hiatal hernia. Now, how should somebody repair that? Well, what we want to do is we want to recreate the normal anatomy as well as we can. So the way all surgeons that are trained in hiatal hernia repair have been trained is to repair the opening behind the esophagus. So what they do is they bring the stomach back down because the junction between the esophagus and stomach, remember, has pushed up above. So what we do is we bring the stomach back down, we close the diaphragm, and the stomach is back down in the abdomen where it should be, and that's to recreate the correct anatomy. That is a true hiatal hernia repair, okay? What I'm hearing is this anterior repair stuff, which is just garbage, frankly. What people do is, remember, you have this opening in front. It's bigger, okay? And what they do is they just put a stitch here to tighten that opening and sort of make it so it's not as apparent. And I put anterior repair in quotes because this is not a repair. The junction is of the esophagus and the diaphragm is still up above the diaphragm. The diaphragm is still open behind here, and the stomach still pushes up through the diaphragm where it should not be. So because of that, you don't actually fix anything. A hiatal hernia means the opening in the diaphragm dilates behind the esophagus. This is a hiatal hernia. It dilates behind the esophagus. The stomach then pushes up above the diaphragm. Scar tissue forms above the diaphragm and holds the stomach up there. Okay? To repair the hiatal hernia, you have to cut the scar tissue. Then you have to put the stomach back down below the diaphragm where it belongs. Then you have to tighten the opening behind or posterior to the esophagus to recreate the anatomy the way it's supposed to be. In fact, putting the stitch in front, the diaphragm isn't supposed to be tightened there. It's just going to rip back out. Your diaphragm is moving every time you breathe. It's the main muscle for our respiration, for our breathing. So every time we take a breath, our diaphragm is tightening. And if you put the stitch in the wrong place, it is just going to rip out. So an anterior repair of a hiatal hernia does not cut the scar tissue. It just puts a stitch there so people can't see that opening during surgery as well. It does not put the stomach back down. It doesn't cut the scar tissue. It doesn't do anything. Doesn't tighten the opening where it should be tightened. And it does nothing to cure the problem. In fact, it may make it worse. An anterior repair of a hiatal hernia is not a repair and should not be done. So to emphasize that, a hiatal hernia should be repaired correctly. This is taught in surgical residency, and the only reason not to do it is because maybe they don't really have a hiatal hernia, or you just don't understand how to do it, or you're too lazy actually to do the operation correctly and you just want to say you did a repair, maybe so you can charge for it, I don't know. But you should repair it correctly if you see it, and it should be repaired, especially if somebody has a gastric sleeve, because if it's not, they're much higher risk for getting heartburn after the gastric sleeve operation. And in any kind of weight loss surgery operation, you should repair it. And so weight loss surgeons should not be doing weight loss surgery unless they know how to repair these, because they're going to see them. Okay, but it should be repaired correctly. And an anterior repair is not a repair, period. It might make the problem worse. So anyway, this is something that I wanted to explain. I'm going to tell people that work with me in the OR about this video, and go take a look if you want to learn something. But this is sort of a pet peeve of mine, and so I wanted to share it with you. If you have bad heartburn after surgery, you see in your operative report that an anterior repair was done, maybe that's the problem, actually, because that's not a hiatal hernia repair. All right, I hope this helped people understand things a little bit. Thank you. Have a good evening.